introduce yourself, one sentence elevator pitch on what you do, and how is your work differentiated and uniquely making an impact in behavioral health?
Thanks, Salome. So my name is Dr. Mohsen Omrani. I'm a co-founder and CEO of OPT. OPT is a B2B SaaS digital mental health platform targeted at healthcare organizations to increase their care capacity and lower their cost. We equip clinicians with clinically validated digital mental health content and AI capabilities to facilitate care delivery and evidence-based practices. We use machine learning and AI to make objective evaluation of patients' mental status and provide clinicians with actionable insights about the best next step in their patient's care. What is unique about what we do is how we are integrated in the clinical care. So it's like we believe that if we are designing anything to be used by clinician, it should fit into their current workflow. That is why we are using natural language processing algorithms. And also, whatever we do is, we put them through clinical trials. We have done more than 15 clinical trials. More than 2,000 patients have gone through these clinical trials. And all the content that we develop and all the algorithms we develop are first validated in clinical trials before we put them on the platform.
Excellent. And real quick, 60 seconds, what are you looking forward to in the next 12 months of your business?
So we are starting a partnership with some health systems and one payer. But what is more exciting, we just recently started a partnership with Mayo Clinic platform that gives us access to their EMR data, like 2.7 million patients, and we are the second company to use large language models to extract unstructured data and try to use that to predict, outcome of the care and be able to suggest the best next care. So we're really excited about that.
I think we all have seen that this category has been tricky for a lot of reasons. It's a very tough one from a regulatory perspective. It's very easy to do something that kind of runs afoul of I think in some cases the FTC and other agencies where we've recently kind of seen a lot of this play out. So what are you all doing to ensure that you are providing that convenience and ease of use that's so important to your patients, while also having really strong kind of clinical independence and making sure your clinical teams feel that they can administer the type of care that they see fit, and then managing the expectations of VCs at the same time?
It's important, to remember when we talk about mental health, it's like any other field of health. It is important that there is validation, and it is like anything that goes out should be validated. We do not expect anything less from any other field in diabetes or surgery. So that's why whatever content we develop, we are committed that it's connected to a clinical trial, connected to a peer-reviewed article. So when we say, for instance, our module reduces symptoms by 40%, there's a paper, you can pick it up yourself. And the other part is that it is important that to know what clinicians actually do before developing something that we think clinicians might use, right? So it's like if clinicians are 90% of their decision is relying on the language use, using something like a temperature, even if it might become very useful, might not be picked up by clinicians. So it's really important to have those clinicians in designing and validating your solutions.
Do you think AI is overhyped, underhyped, just hyped enough when it comes to your particular category or company?
One challenge that I think exists in this field is that a certain usage, like ambient, summarization, becomes the, thing that everybody thinks about it when we talk about AI. It is, that becomes overhyped, but there are so many different uses. It's a technology, and it could be used in many different ways, and we are really in the initial days of it.